Hey, this is Michael Johnson, the president of Boys and Girls Clubs of Dane County, and really excited about our town hall meeting tonight. There are many faces of young people in our community and healthcare providers who will be talking about the importance of vaccination. So let me just first just say kudos to all of the folks who are on our panelists today, and especially our young people who are taking time out of their schedule to be a part of this important discussion. I also want to say that I am, proud of some of the work that our county has done. So far, I learned this morning that 50.8% of Dane County residents are already vaccinated. And when I looked at some of the numbers, kudos to the American Indian community. 52% of that community is vaccinated. The Latino community is at 29%. Our white neighbors are at 46%, and our Asian community is at 35%. But in our African American community, right now has the largest disparity. Only 19% of African Americans in Dane County are vaccinated. So we want to have a discussion today. We want to hear directly from our young people and healthcare professionals about why people should be vaccinated, why this is important for our community, and we wanted to lift up the voices of our young people. So let me introduce you to some of our phenomenal young people in this community. I'm going to start with Savannah Montgomery, who is a current college student as part of this discussion today. Tyla Hayes was also a college student. We have Farhiyo M Ali, who was a high school student in our area. And then Daniel Yancey should be joining us, who was one of our recent college grads who grew up in the Boys and Girls Club. We got my man Tawan Short, who is a college student right here in Madison. And then we have Isabella Yang. And then we have with us, who is facilitating this amazing panel today, Dr. Jasmine Zapata, who was just announced as not the Chief Medical Officer for Community Health for the state of Wisconsin. So Dr. Zapata, who is also a Boys and Girls Club board member, congratulations to you. We're always so proud of your work. Then we have Cierra Brewer, who works at UW-Madison School of Pharmacy. We have been grinding with them over the last couple of months to make sure that people in our community is being vaccinated. So thank you, so much for your leadership. And then we have Delora, who is at UW-Madison School of Pharmacy. I just said that. And Lisa Imhoff, who is the Associate Dean of Diversity and Inclusion at UW-Madison School of Pharmacy, and has been very instrumental in helping us get people vaccinated right here in our backyard. Then we have Dr. Yinka, who's a associate professor at UW-Madison School of Pharmacy, and has been on the front lines working with us for weeks now. And then finally, we have Dr. Tellez-Giron, who is also an associate professor at the School of Medicine and Public Health. So I want to welcome all of you and thank you for being a part of this conversation. And I'm going to turn it over to Dr. Zapata. I'm going to shut my mouth and just listen and learn from some of the best and the brightest in our community.
Thank you so much. It's so amazing to be here. I'm so excited to be able to help moderate this really important discussion with our young people. Thank you for everyone who made it out on this wonderful afternoon, and I'm so excited to get started. So before we jump into our conversation, I want to hear from everybody who's in here in our virtual space here, and then even those of you who are watching on Facebook Live or other outlets. If you could just put in the chat one thing you're excited about, one activity you're excited to do when we go back to normal, or like after COVID is over. What is one activity that you're excited about? Going into the summer, kind of activity you're excited about getting back to. So our young people in here, our healthcare providers here, our guests, you could just put it in the chat, or if you're watching on Facebook, just put it now. So let's see. There are people who are excited about travel. let's see, some other things, hanging out with friends. I know I missed that. Seeing my mom and dad, seeing friends, in person learning, hugging. I'm a big hugger, so I can definitely relate to that one. Beaches, definitely. Yes, so there's a lot of exciting things to look forward to. It's definitely been a hard last year, but there is still hope. And that's why I'm so excited that we're having this conversation today. Thank you to the Boys and Girls Club of Dane County for hosting this, and Madison 365 for facilitating this important youth panel so that we can talk about some of the strategies to get to that point. We do know that vaccines are safe and effective. They're one of our tools in our toolbox to be able to get back to some sense of normal, or get to do some of the things that we haven't been able to do over the past year. But there is still a lot of hesitation. There's a lot of questions that people have about this. And that's why it's so important that we're having continuous conversations in a safe space so that we can process our feelings, we can talk about it, and especially for young people to get their questions answered. Hot off the press this week is that many of the federal regulation agencies actually approved the Pfizer vaccine for as young as 12 years old. So now 12 years old and up can get the vaccine. This is hot off the press news. And again, it's why it's so important that our young people have a space to get their questions heard. So we're so excited that you're here today. Make sure, if you're watching on Facebook, to press the share button so that we can disseminate this information and get everybody involved in this important conversation. So what can you expect over the next 45 minutes or so we have together? What we're going to do first is hear from some of our young people. They are going to give a little bit of their perspective on how COVID-19 pandemic has impacted their lives. And they're going to just be open and free and share about what their stance is on getting the vaccine or not. Then what we're going to do is we're going to open it up, the discussion, with our special healthcare professional guests and community guests that are here tonight, so that our young people can ask them questions and we can have a great conversation about any questions they have regarding COVID-19 and the vaccines. And then we'll wrap it up after that. So everybody that's on the screen with me here, put a thumbs up if that plan sounds good. Is everybody ready? All right. So what we're going to do now is we're going to just open it up to our young people. And for all of our special young guests that are on here, if you could just, again, say your name, where you are in your schooling, and then just give us a little bit of information about how COVID has impacted your life and your honest, open opinion about where you are as far as the decision to get the vaccine or not. So we can start. I'm gonna just let whoever wants to go first. Whoever wants to go first of our special guests that are here, of our young people.
I can go first. Sorry about the noise in the background, but I'm Isabella Yang. I go to James Madison Memorial High School, and how COVID impacted my life as an Asian American, it is hard, seeing the rise of Asian hate crime that has been happening. It also affected my education as well, since I am virtual now, and it is a little bit harder to learn. My current status on the vaccine is I'm actually getting my first dose this Saturday, so I'm excited about that. So yeah, that's something about me.
Thank you. Thank you so much for being open about that. And I'm sorry about all that has been going on, but I'm happy to see your face and that you are here and having a conversation with us. So thank you so much for being here. All right, who wants to go next?
Hello, everyone.
I can go. Oh, sorry.
Go ahead.
Hi, everyone. My name is Tyla Hayes. I am a junior nursing major at Tuskegee University. I'm from Madison, graduated from East High School. COVID has definitely impacted my life. It made all of my classes be online, which ultimately made me push back my starting the nursing program. So starting my clinicals and stuff a semester. So it's definitely impacted me, and my stance, being a nursing major, I am kind of conflicted just because I think I don't really know or have enough information about the vaccine to really be able to form an opinion on if it's better for me to take it or not. But I do know with starting clinicals, I will have to get it. So I am a little conflicted, but that's why I wanted to do this panel, just so I can get some more information for myself, as well as my fellow nursing students and some friends. So.
Well, thank you so much for being here. Congratulations on your path into the medical field. And this is exactly the right place to be, just having conversations so that you can make the best decision for you. So thank you so much for being here. And I'll pass it on to Savannah.
Oh, hello, everyone. I'm going to be a returning junior at Xavier University of Louisiana, studying chemistry on a pre-med track. COVID impacted my life a lot in regards to schooling. It was very difficult switching to online, so having all my labs online and it taking hours in comparison to 2 hours. And just, I think, overall, just being more depressed when isolated has really that's how COVID has really impacted me. My current stance on the vaccine is I am fully vaccinated. I don't think I would have been fully vaccinated if I didn't do my own research and had to do research on the vaccine. So I'm here to learn more and to gain more knowledge to inform others.
Thank you. And thank you for opening up about a topic that a lot of people are not open to talking about, which is mental health, which is so important. So thank you for being transparent about that. And I'm so glad you're here. All right, who wants to go next?
I can go. Hey y'all, my name is Daniel. COVID's impacted my life kind of, for lack of better terms, kind of like forced me to grow up. I was very involved in like the downtown life at the time. Still in school too. I was virtually at Herzing University already, so that didn't really like have too much impact on me because all my classes were virtual prior to COVID as well. But I guess it helped me very much financially. I was able to, break down my expenses and everything like that. My stance on the vaccine is I got the vaccine back in December. I used to work at a hospital in Madison, and being a frontline worker and being involved with those COVID units, I felt like I was one step closer to the end, or I can't figure out the word for it, but yeah, I was helping. I felt like I was helping by getting the vaccine, and I think younger people should all get vaccinated as well.
Thank you. Thank you so much. And who is next?
I can go next. My name is Farhiyo M Ali. I'm a junior at James Madison Memorial. COVID has impacted my life mostly in my education in school, switching to like online courses because I've like never done that before. So I think that's like that's where it affected my life the most. And my stance on the vaccine is that I'm fully vaccinated, and I will definitely recommend taking the vaccine to everybody so that we can go back to normal as soon as possible. And for people who are aren't considering taking it or have doubts about it, I think that it's something that you should definitely go and do so that you can support your community and we can be back to normal again.
Thank you so much. Yeah, it would be nice to get back to all of those things that we talked about earlier, getting back to some sense of normalcy. And then another thing I want to say, a lot of times we talk about people saying going back to normal, back to the way things were. But I do want to acknowledge that for some of us and some people that even before COVID, there were a lot of inequities and disparities and problems. We actually want to create a new normal, a new world. So even though we say go back to normal, I still do want to acknowledge that we want a new normal. We want things to get even better than they were. All right, who wants to go next?
I can go next. My name is Dur. I am a fourth year pharmacy student going on to rotation in about a few days now. I'll be stationed on Eau Claire. COVID has definitely impacted my life. So for the last year or so, everything was virtual. Learning was definitely a lot harder. I usually study with my friends, and we usually ran through everything to make sure we memorize all the drugs and, mechanism of action, all those sorts of good stuff. But yeah, it was definitely harder to have a study group online virtually. My current stance on the vaccination, I fully support it and fully vaccinated. I will start taking care of patients as soon as my rotation starts. And in order to protect my patient's health and myself as well, I fully support getting vaccinated.
Thank you. I love the protecting your whole community. It's not just about protecting ourselves, but protecting our whole community. Thank you. Who's next? Oh, we can't hear you. Can you try to unmute? Yeah, we can't hear you.
Can you hear me now? Okay.
Yes.
Hey everyone, my name is Terwan. I'm a rising junior at UW-Madison studying finance. Graduated from Madison West. Right now, I got my first Moderna shot 3 weeks ago, so I'm getting my second one next week. So I'm fully for it and support anyone who wants to get the vaccination. And pretty similar to everyone, COVID has impacted me with school. Like for me, I kind of had half a semester in person, and I got to go to office hours, got to make friends in classes. So that's something really nice that isn't happening anymore and is affecting everyone. And second to that is I'm a people person, so it's nice being able to talk with people, talk to my professors even, and get that energy. And I think that's really important. And hope everyone gets vaccinated so we can get back to that soon. Because today the CDC said if you're fully vaccinated, you don't need a mask. So the quicker everyone's vaccinated, the quicker we're back in each other's faces and having fun.
Thank you for opening up about that and sharing your story. I did see that on the news today, and it seems like you're pretty excited about that. Even when I go outside and I don't have my mask, I feel just because we've been wearing it for so long, it feels like I'm naked. I'm like, oh, my mouth is showing, my face is showing, because I'm just not used to it. But it is very exciting to imagine things going back to the way they were, or even our new future, but without having to wear masks. So thank you for pointing that out. And I think we might have one or two more young people who want to introduce themselves. Okay, I think, well, that might have been everybody. Did we get everybody? All right. So what we will do now is our next portion is going to be an open time where our young people will have a chance to ask their questions of our special guest panelists that are here today. But before we get into that, I want to have an opportunity for our special guest panelists in their own words to introduce themselves, just say what role you play in the community and why you are here today. Why did you take your time out to have this special time to talk with our young people? So I'm going to give a chance for all of our panelists to go around. You can just unmute yourself, say your name, your role, and why you are here. Why are you so passionate about this topic and being here tonight?
Hi there, Patricia Tellez-Giron. I'm a physician and an associate professor with the Department of Family Medicine and the co-chair of the Latino Health Council. We have been doing education with our community now for over a year, and it has been very distressing to see how our communities of color were hit so hard with COVID. So not only did we start with health disparities, but then we also got hit very hard with this. And that's why I am going even door to door if possible for people to ask me their questions about the vaccine and to gain access for them to get the vaccine, because I think we need to be first this time and not last like we usually are. And we need to give people the chance to ask questions, but also to have access to the vaccine. So thank you for having us here, and particularly for our youth. If you don't do it for yourself, do it for your family, do it for us. Because if you don't get the vaccine, we are still all at risk. So thank you for being here today.
I'll go next. My name is Dr. Olayinka Shiyanbola. I'm an associate professor at the School of Pharmacy. And I've been working together with the Boys and Girls Club as well. I mentioned that yesterday, doing vaccinations in the community, increasing access to people that don't necessarily have the ability to maybe go to the healthcare system to get it. So we want to take the vaccine to where people live, where people work, so that we can increase access. This is important to me because, first of all, I have been studying misinformation for a really long time about medicines. And so it's important for me to be here to be able to address any misinformation that people have heard about vaccines and making people realize the importance of it. It's also important for me to be here because I lost my father-in-law to COVID. And so I don't want to lose any more family members. And so it's important to let people realize COVID is serious. Vaccines can help us. And so it's important for us to come together and talk about it. So thank you all for allowing me to be in this space.
I can go next. Hi, everyone. My name is Lisa Imhoff, and I'm the Associate Dean for Diversity and Inclusion at the School of Pharmacy. And why I'm here today, a faculty member actually asked me, which I know Michael Johnson, should I reach out to him to think about how our students can help be out in the community? And I was like, yes, that's a wonderful idea. I used to do counseling in the community, in families' homes. I would at times go to the Boys and Girls Club to meet adolescents where they were at. So I thought the idea of our pharmacy students being able to go out in the community where need is to address issues of equity and access was a wonderful opportunity. And also a partner with us is Fitchburg Family Pharmacy, who has been doing a lot to meet our communities in need. And then on a personal level, my mom and my uncle were very, very sick with COVID. And that just, it hit me in the gut. And then I think, I do have this mental health background as a social worker, and we have been faced with multiple traumas when we think about COVID-19, racial injustice, continued harms that are done to communities of color. It's just taken a toll. And I think this is an opportunity for us to collectively move forward and together and heal. So that is my hope with being with the community. It's healing.
Hello, my name is Cierra, and I am a recent grad of the UW School of Pharmacy just last week. And so I am here because of working with Dr. Shiyanbola and her lab, and also being able to volunteer at the vaccine sites that the Boys and Girls Club has had the past few weekends, and being really able to see in the community people showing up, or the lack of people showing up, and being able to share information with people so that they can make an informed decision.
Thank you. And congratulations on graduation. So exciting. So exciting. I think that was everyone, all of our special panelists. Is that correct? 1, 2, 3, 4. Okay. So now what we're going to do is we're going to just turn it over to our amazing young people. I'm going to turn it over to you all now so that you can take the lead and ask questions. Yes, I am the moderator, but I might sneak in a couple answers. I can't help myself being a pediatrician and a public health leader, but we'll focus on our other special guests that we have here. So this can be, we're going to go for about the next 20 minutes. We'll treat it kind of like a hot seat where you guys can just ask a question, and then any one of our panelists will just jump in and answer. We have about 20 minutes for this segment, so I'm hoping to get some rapid fire questions in. This is a safe space. There is no stupid question. All your questions are important to us so that we can answer and really make this a good conversation. So does that sound good to everybody? All right. So how we'll do it is we're going to start with Savannah. Savannah, if you can just ask your question, we'll open it up to our panelists. And then when you are done and you feel like you got a good answer, then our next young person can just jump in and ask their question. Does that sound good?
Yes.
And we're hoping that we get a chance for every one of our special young guests that are on here to get to ask at least one question. Also, for those of you who are watching on Facebook Live or other outlets, you can type your questions in the chat as well, and we have people to give us the questions here. So let's get started with Savannah. I'm gonna hand it over to you. We'll have a panelist ask a question, and then our next young person will go right after that.
Hello, everyone. My name is Savannah once again. So the question I had is in regards to social distancing. A lot of times in college, you see a lot of students not social distancing. And I just want you all to talk about what is the difference between, like, you know, being, for example, if kids were out in a crowd with mask on compared to like not having a mask on without social distancing. Can you just talk about those two scenarios and how them not following the rules affect others?
Dr. Yinka, can you start us off?
Yeah, absolutely. So if I understand the question, what is the difference between somebody who is in a crowd wearing a mask versus somebody who is not wearing a mask? And am I right with that question, Savannah?
Yes, ma'am.
Okay, so I like to follow what the science says, and what we know is wearing that mask actually protects you and also protects the person if the person has COVID or you have COVID. So by wearing that mask, because it's a respiratory illness, right? You are breathing into each other. So by you wearing your mask, if you have COVID, you are not able to pass it on to the other person. And at the same time, if the other person has COVID, the person is not able to pass it on to you. So it's almost like a barrier to prevent you from having it. And I know when COVID happened, they put out lots of pictures and a lot of information to show people actually what that barrier looks like. It's like droplets, right? It's like air droplets when you speak. And so that's why the nose, the mouth is important for that to be covered from. And so it's protecting you and protecting the other person.
And then just a follow-up, how would not wearing a mask affect others around them? Say like young college kids who think that wearing a mask and not wearing a mask in a public space is okay.
So, I think what is very important to know about that right now is that there have been a lot of very rapid changes, right? Like CDC did even more changes today about the mask, right? So it's hard to keep up with what the guidelines are. But for example, right now, as you heard before, it's only a percentage of the population that has been vaccinated. So you still have a lot of people that are not vaccinated. And as far as we know, even if you're vaccinated, you can still have some viruses and you can still pass this on to other people. So I could say that I am wearing the mask more for other people than myself because I'm fully vaccinated, although the vaccines do not protect 100% to get the disease, right? So it's still a little bit the other ones protecting me, but very much me protecting others. So if you are outside and you are not observing the distance and you don't have a mask and you don't know who is vaccinated, the risk is still high that you could pass the virus. And remember that sometimes you have minimal symptoms or no symptoms. And that's why people, even if they are not bad people, they don't know if they have the disease and they can transmit it to other people.
Thank you both for your response.
All right, and Isabella, how about you go next?
Yeah, I'm Isabella. My question is, do youth experience the same side effects as an adult with the vaccine?
Lisa, do you want to start that one off?
I actually do not feel comfortable answering that question, so I will defer to the health professionals that are administering or are more knowledgeable about that.
What about you, Cierra?
What I would say is that the data is new on the vaccinating children under the age of 16. But with Pfizer, when it was originally studied, it did show that sometimes the side effects, such as a cold or a cough or things similar to like the flu or the common cold, was actually more common in those that are younger. But what I always tell patients when they have those symptoms and they have some concern, it shouldn't last more than 72 hours. And it's just a sign that your immune system is mounting a response. And so that's also like a confirmation of like the vaccine is doing its job, but we are all different. And so how we respond to the vaccine is specific to the individual. And that's something that I also like to tell patients when I'm giving them a vaccine, because what happened to me might not happen to you, and what happened to maybe your grandmother, your grandfather, compared to what might happen to a child that is high school age, it's all very different. And so data is being collected on a continual basis, but nonetheless, the side effects that have been experienced, regardless of age or specific to race, for patients that are getting the COVID vaccine is something that is possible with all vaccinations and not necessarily specific to just the COVID vaccination.
The most common ones that I've been hearing as far as under the age of 18 of pretty much the same ones as adults. Sore arm is the biggest one, could be a little bit of headache, chills, just kind of feeling under the weather. But as Cierra was saying, after about 72 hours or less, then it just clears. That's the most common thing that has been seen. Would you have anything to add, Dr. Yinka or Dr. Patricia?
And you can always use Tylenol. So it's interesting when, parents bring the little kids to the clinic, we always say, and they could have these possible side effects. So please, when you get home, do Tylenol or a warm bath, just the same. So if you have any side effects, you can have some Tylenol, warm shower, and you should be okay. And youth, you are very resilient and you can do it.
Does that answer your question, Isabella?
Yes, it does. Thank you so much.
Great. Who would like to go next? I'm trying not to pick on y'all, but I will if I have to. Who's excited about the next question? Who's going to go next?
I can go next. My question is, what is the biggest misconception that youth ages 16 to 25 have about COVID?
Okay, I can answer that one because I have been studying misinformation for a really long time. The misconception that I have heard and that we've seen is some of them are actually very similar to what adults are saying, which is COVID-19 sometimes is not true, is a hoax. And so because of that, it's not a serious thing. One that is very particular in that age group is, I'm not gonna get sick from it. It's happening more to people that are older. And so there is a lot of misinformation out there that you're young, just like Dr. Patricia was saying, you're resilient, it's not gonna affect me. I actually have a young family member who is in that range, who is not thinking of getting the vaccine because the person feels like, man, I'm strong. Nothing can do my body is what they say. And it's misinformation because even if nothing happens to you, you could be passing it on to another family member who is maybe at risk, or the person is vulnerable, or the person has not a very good immune system. And so I see similar misinformation that adults have, but for younger people, we even see on top of that, well, I am young, I'm fine, I have a lot of energy and strength, so it can affect me.
Thank you, Dr. Yinka, for that perspective. And thank you for all the research you've been doing into that. It's so important. And one thing that I would add that's on my heart, because I've been having conversations with my children about this as well, especially now that the vaccine is approved in the younger age groups. It is true that most young people or under the age of 18 that get COVID-19 have mild to no symptoms, a very mild case. But there are people under the age of 18 that have died from COVID-19. The last data that I looked at, I believe it was around 250 young people who have died from COVID-19 in the United States. And while some people might say, oh, just 250 people, from my perspective, one child that dies from COVID-19 is too many. Even if it was 5 or 10, it's too many. So we want to protect all young people and, yes, protect our communities as well. So when you hear that, oh, even if I get it, it's not a big deal. That is true that, you know, for most young people, it doesn't cause severe cases or hospitalization or death for most, but there are young people who passed away from this, and that is too many. And that's something very serious that we all need to protect against. But let me stop. I'm just the moderator. I'm not supposed to be answering questions. Did that help to answer your question, Fario?
Yes, absolutely. Thank you so much to everyone who answered.
Okay, awesome. Who wants to go next?
I can ask a question. So for someone like me who has had COVID, so I got COVID last June, as well as some of my friends, they were wondering about this too. For someone who's had COVID and kind of knows the symptoms that I had, and they were kind of mild symptoms, they weren't really bad. Just like, why is it important for me to still, you know, after a year of doing the isolation and kind of, you know, being by myself, you know, I'm getting bored in the house and like staying away from big gatherings and social events. So why is it important for me to continue to distance myself, although I know that like me and majority of my friends who have had COVID know that our symptoms won't be that bad. So why is it important for me to continue distancing, knowing that for myself and my friends, it's not really bad and we've had it already?
I can go ahead and answer. I think a couple of things just from what I've read is that, you know, there are multiple variants of the virus, and the strain that you had might be, you know, different than the one that's circulating. So you could get the other variant. And again, you don't know the status of everyone else around you, right? Like, you know that you've had COVID, but let's say you're in the social gathering and someone has not had it, you can get, and I've heard you can get reinfected, but I will defer to the health professionals. But I've heard that people have had COVID and then been reinfected. So they really don't know much about the virus, how long it stays in the body, how long you have immunity for. That's why we're thinking the boosters are coming potentially down the road. So I guess those would be a couple of reasons that we would still want to maintain whatever the public health officials are saying in the CDC. What would Dr. Tellez-Giron?
Yeah, so you're right, Lisa, that with this virus, it's a very different virus where getting the disease does not assure you that you have immunity. So we have had patients that had COVID and then months later had another COVID case. So when they have been doing this, they noticed that some people had only very partial immunity even after the disease, even after moderate or severe symptoms. And that's why the immunity that having the disease gives you is not close to the immunity that the vaccine will give you. So the vaccines right now, we know that they are guaranteeing at least 6 months, if not more, of immunity. If you got COVID, we cannot say that you have immunity yet. So you can still get COVID and you can still give COVID to other people. And I thought that you were going to ask, and if I already had COVID, why do I need the vaccine? And I just answered to you why it's important to get the vaccine, because we still don't know if you have immunity. And, you know, some people say, well, I'm going to go and check my antibodies. Well, that is not the same, again, as the test they are doing after you get the vaccine, you know, particularly to the people that has been in the trials. And that's what they are accounting for, immunity with the vaccine. So definitely, I will encourage all your friends, even if they got COVID, that they should get the vaccine and they should get it as soon as possible so that you guys can be together and you don't have to keep on isolating yourself.
Thank you. I did just have another kind of follow-up piggyback question from that. I know that you said that, just because you have COVID, that doesn't mean that we're immune to getting it again. Is there any research or anything that supports, like, percentage-wise, like, are we still at the same risk of getting COVID if we've had it before, or does the likelihood of us getting again go down because we've had it before? Is that still kind of waiting on more research to know about that?
Let me tell you what my take is on that, and other people can chime in. That kind of research will be very difficult because we don't even know the numbers for people that actually got COVID, because there are people that were asymptomatic but still had COVID. And then we also have people that had very mild symptoms that was never tested for COVID. So we don't really know how many people really got COVID. So it will be really difficult to do a percentage of from 100 people that got COVID, 5% had this kind of immunity or that kind of immunity. I think by logic, with other experiences that we have, we think that you will have, after getting COVID, immediately after, had some immunity, but again, we don't know how long that immunity will last. For some people, it could be a couple of weeks, and for some people, it could be 6 months, but we don't know that is the case. So I think it will be very difficult to exactly know what the percentage or what the risk is. And we know that with this virus, the risk is very high.
Okay, thank you.
Great questions. Thank you so much. All right, who is going to go next?
Hey, this call has been very informational, and thanks for speaking. I'll ask the next question. So this semester, I noticed here in Madison, they tried to do a hybrid where you do some days in, some days out. And it was either today or yesterday. Randy W., the head of the teachers union, said we should go back next year, like all the students. So my question to you all is, do you think the science is saying it's safe enough to go back to classes? And do you see us going back 5 days a week next year in school learning?
I can answer that since I teach at the college. I teach at the university. So I'm hoping that the university and campus officials are following the science, and I know there's been lots of talk about us coming back to campus, for example, everybody in the classroom, of course, with social distancing. It is possible that we can come back 5 days a week. However, it's going to be based on capacity. So for example, if it's a large class of 120 people, I don't think it's possible, if you don't have space, to fit everybody in for 5 days a week because we don't have space. So it is possible that some things will still stay hybrid, where we would have something online and then some things, considering the 6 feet apart space, we would have it also in person with some social distancing. So I still see a little bit of a hybrid. So that is what I would say about the possibility of coming back 5 days a week. However, if it's a small class, like an elective, then it is possible that we can come back 5 days a week. Like I said, I'm hoping, at an institution, that we are following the science and listening to what the public health department says. If the public health department says we can come back, we will all come back. And I believe that is what the university is planning for. However, if things change, because things do change, and for any reason we have a variance, for example, like we talked about, I believe they would hopefully make the right decision to have us maybe figure out, maybe not everybody come back in person yet, maybe still stay online. But I'm hopeful that we can all come back together. And I'm looking forward to seeing my students as well and seeing them in person, because in-person learning, as we know, is really important and works better, at least for most students.
I would just add to that vaccine is going to be the clue, right? So that's why the university has been so adamant about the students getting the vaccine, because at this point, what we know is that if the majority of people has the vaccine, we are going to be faster on going back to what you are asking. So that's why it's so important for the majority of people to have the vaccine. And obviously there has been some talk about requiring the vaccine for some schools. And, there are many other controversial things with requiring a vaccine. But, some places might decide to do that in order for people to go back. Right? We are seeing in the news now some cruise lines that are going to have cruises only for vaccinated people, and like that, I'm sure that we're going to start seeing more. I also think that the mask is going to become one more part of our attire if we are smart, right? Because we saw this season that because of wearing the mask, the majority of people, not all, the flu season was so mild. So that is teaching us that the mask actually has a place for us on, preventing certain diseases. So for me, the other day, my sister said, we're going to have a mask burning ceremony. And I say, no way, don't touch my mask. I'm going to frame my mask because that's what has been keeping me safe. So why would I, put it in the fire? I actually want to keep my mask, and I will be using my mask everywhere, regardless from now on, when I travel in a plane, everywhere, even if COVID is gone. It's like I just want my mask with me. So I think that is going to be important. And even though you go back to school, that you think safe and consider continuing wearing the mask,
Ooh, that was good. It reminded me of how the cases of the flu have significantly decreased this winter. It essentially was erased because of all the masking, good hand washing, social distancing, which is so interesting. So I know personally I'm going to be wearing my mask a lot too, just to be extra careful for a while. So thank you for sharing that. We're going to have Daniel go next.
Hello. So I guess my question is, what information can you give out to not only like the younger population, but just everyone in general that are kind of like afraid of the vaccine or scared of getting it? Because like a lot of people's head is kind of wrapped around of like, I don't know what I'm putting into my body, things like that. And, me not being a medical professional, I'm like, well, do you read the back of Tylenol or like Advil? Like, what are you putting into your body then? You just know it takes care of a headache, so you're taking it, So what information can you provide to those that are kind of scared about that?
I'll start with this one first. I like to make everybody feel validated when they have those concerns because there are things in history that have happened that sound absurd. So when people come with oh, I'm nervous about it because they developed it really quickly, or how is it a vaccine for COVID, but we don't have a vaccine for other things such as HIV or other infectious diseases. It's valid to feel that way and have those concerns because things like the Tuskegee trials, that sounds absurd to not treat somebody with syphilis when there's a cure, but it happened. Or like Henrietta Lacks, where it's they literally took her cells and then explained to her family members what it meant when she was still alive, when they had buried her years before. Those things sound absurd, but they happened in history. And so it's very understandable that people have those concerns, but we have more people of color in places that are able or are in positions to be able to hold conversations like one we are having today, able to speak to our community and share the facts related to the vaccine, which we don't have all the answers, but the information is available. But as you mentioned, not everybody is a healthcare professional. So it is sometimes difficult to be able to understand what information that they have out there, but it's available to us. So making sure that we're using our resources. And also when you come in to get the vaccine, it shouldn't be a rush process if you have those concerns. People are available, at least when I've given a lot of vaccines in the Milwaukee area, and just we can sit down and have a conversation because I want you to make the right decision for you, because at the end of the day, it is your body. And there's a lot of things going on in the world And this thing.
Did she freeze up for anybody else?
Have
oh, there you go.
Sorry. I don't want to force patients to make a decision where next time they have to do the same thing when it comes to another health problem. They are now, like, I guess in a way, scarred because of what they decided the last time. So being able to make an informed decision for yourself is very important. And so access to information is like the biggest thing that can help to that, because I totally feel that all of those opinions and hesitancies that people have are valid, because history and government, like, is proven, they have done it before. And unfortunately, we, like, as individuals cannot stop it from happening again. But that's why, like, I went into pharmacy, so I could be able to shed a different light in my community and keep us in.
Thank you, Cierra. I think you were just finishing up. You're freezing up a little bit, but okay.
I'm done.
Oh, okay. Well, thank you so much. I totally agree with allowing people to have conversations and feel comfortable. I know that this is rushed, but we didn't get into this position overnight with much of the distrust or historical traumas that have happened in our communities. So we can't expect to just have everyone perfectly trust the healthcare community and get the shot overnight. It's going to take time and conversations like this. So I love what you said about respecting that people do need sometimes to have these conversations to build trust. So thank you so much. Oh my goodness, look at the time. We were having so much fun that the time just flew by. So now we're going to go to our closing comments. I'm just so thankful for each and every adult panelist that was here, for all of our young people who came. These are some great questions that you all asked. And how I would like to end it is maybe if I can have just one or two of our young people just say, what was one of your biggest takeaways from tonight? And then we'll end with an encouraging, just any one short word of encouragement from our special healthcare panelists here today. So can I get one or two of our young people just to say, what was one of your biggest takeaways from our discussion today?
Well, I guess for me, like, a really big takeaway for me, it's like, you should get the vaccine, even though if you don't want to, but it's good to protect your community and also, like, your family members. So it's like, even though you don't want to, but you're just protecting others, basically. That's like the main takeaway I got.
Thank you. What about you, Savannah? You're smiling hard over there.
I think the biggest takeaway for me was just doing, research and asking healthcare professionals, as Cierra was kind of saying, not being afraid to ask those questions. And I think that is a big problem within, minority communities, is the lack of trust between them and their physicians. So being able to ask those questions and hearing all the feedback, definitely makes me confident to ask my physician questions when I have them. So that was my biggest takeaway.
Excellent. Thank you so much. And now I'll hand it over to our adult panelists just to give one last word of encouragement. And I'm going to pick on Dur to start us out.
Thank you so much, Dr. Jasmine. I just want to say, if you guys have any questions, please don't hesitate to reach out to any healthcare provider. We are all learning as a community, and collectively we should all work together in order to get vaccinated and kind of produce some sort of normalcy. Even though we don't go back to normal, we can always produce a new normalcy and always be positive, because we can fight this virus off. Thank you so much, everyone.
Thank you. And what about Dr. Patricia?
I'm going to say we need you. We need all to get the vaccine. So if you don't want to do it for you, I hope that we convince Tyla to get her vaccine. But if you don't do it for you, do it for your friends, do it for your family, do it for our communities, because we need to all have the vaccine so that we can end this virus, so that the virus will not have a host to continue growing and reproducing. So thank you for being here, and please take this information to your peers.
Thank you. How about Dr. Yinka, and then Cierra, and then Lisa?
Thank you all for allowing me to be here. The one thing I would just say is please pass this information. Peer support and peer information speaks louder, sometimes even more than the adults. So please, young people, tell your friends, let everybody know you got vaccinated, tell them why you got vaccinated, tell them why it's beneficial to you, and so that we can all come together back as a community.
I just want to say we talked a lot about our friends today, but also remember, like, especially being a young person, I'm going back home to my parents' house in a couple of weeks. And so it's important to remember our moms and our dads and our grandparents. And like, we hang out with our friends, but at the end of the day, if something happens, those are the people we're going to call on. That's where we're going home at the end of the night. And so it's important to consider them and their health as well.
I just want to say thank you so much for being present today with all your wonderful questions. I think if you need to keep on finding research, please do that. Take your time. I really echo Cierra's thoughts, like have your concerns be heard. And I also want to say, you are the next generation. You can kind of change the trajectory for communities of color, kind of building, and hopefully it's on the healthcare providers too, they got to build that trust, but it could look really different in the future. And these inequities can be really shrunk. That's my hope. So thank you so much. You're all just really intelligent and great questions. So happy to be here with you all today. I got new life in me.
Well, thank you. That wraps up our time together. Thank you to all our panelists, all our young people. Thank you to the Boys and Girls Club of Dane County for facilitating this. Thank you to Madison 365 for helping to stream this. Together, we are going to get through this, and everyone stay encouraged. We love you all, and have a good night.
This is 365 Media.